Hello and welcome to our back desensitization exercises. These are to slowly encourage a healthy range of motion throughout your lower back after it's been injured. Now we're going to go through a few exercises. Make sure that you only do the exercises that you've been shown during your treatment. We're going to first start with exercises to gradually improve the range of motion and flexibility, and then we're going to move on to conditioning exercises to make sure that that you're getting long-term relief from the exercises. First exercise that we're going to go through is a flexion exercise. So from here, what I want you to do is place your hands between your legs. I want you to bend forward using the area of your lower back that you feel is most sensitive. So say if it was my mid-back, I'm going to try and use my mid-back as much as possible. So from here, I'm going to slump forward using the area of my lower back to get further and further down. Now, as soon as I feel about 6 out of 10 level of discomfort or tension, I'm going to hold that there. After 30 to 60 seconds, I'm going to slowly come up using that part of my lower back, and then I'm once again going to roll forward and go down. And you should notice that you can get further up and further each time. You want to just repeat this a few times, a couple of times a day. We're now going to encourage extension, which is bending backwards, and to do that, you're going to move onto your front. And from here, what I want you to do is place your elbows underneath your chest, and you'll see as soon as I do that, my chest comes up. Make sure that you lay your back down against the ground. Make sure that you press your pelvis also down against the ground. You want to go up until you feel about a 6 out of 10 level of discomfort in your lower back. Hold it there for 30 to 60 seconds. After that, you'll very slowly go it down. Once again, you'll go up again, and you should notice that you have to go up a little bit further this time before you feel that 6 out of 10 level of discomfort. Once again, you hold it there for 30 to 60 seconds, go back down, and try once again come up until you feel that 6 out of 10 level of discomfort. The aim is to make sure that you're getting further and further each time before the pain kicks in. The next exercise I'm going to show you is to improve side bending, so bending from side to side. To do this, you need a wall. You'll lean against the wall with your feet further away from the wall. You'll then place your hand on your pelvis, hand here, and you'll try and push your pelvis into the gap created underneath the elbow. Now you should feel the tension on the same side that you're pushing. Once again, just a 6 out of 10 level of discomfort, and you'll hold that there. 30 to 60 seconds, repeat a couple of times. We're now going to move on to exercises to condition these ranges of motion. The first range of motion we'll focus on is flexion. To do this, lay on your back, and from here, you're going to press your back down against the ground, and you're going to come up with your knees. Make sure that it's your abdominal muscles that are doing most of the range of motion. So from here, once again, you press your back down against the ground, tilt your pelvis up, and try and take your knees up to your chest, making sure that you're talking or that you're breathing the whole way through. Now you'll probably be asked to do 3 sets of 5, 3 sets of 10. The main thing is that you focus on quality rather than quantity, making sure that you're getting a nice crunch at the top. And as well as that, add 1 rep each day. So for example, the first day might be 3 sets of 5, the next day might be 3 sets of 6. To condition the extension, from here you're going to place your hands on your chest, and what I want you to do from here is to drive your pelvis up towards the ceiling. As you do that, you should feel that your bum muscles, back of your legs, but also your lower back muscles become quite tight, and that's normal. As soon as you touch back down, back up again, touch back down, and back up again. You might feel that this becomes quite easy after a while. To make it harder, you'll simply just raise one leg into the air, push up, and back down. Push up, and back down. The next range of motion is rotation. So from here, what you need to do is raise your knees up, and once again, push your lower back down into the ground to engage your abs. And from here, you need to very gradually take your knees from side to side, making sure that you're mainly rotating the pelvis rather than just moving the hips. So once again, you'll see my whole pelvis lift up and drift over. 3 sets of 10, 10 each side, or 3 sets of 5, increasing 1 rep daily. As well as this, you will probably be asked to incorporate an ice protocol, so to place ice on your lower back for 20 minutes per hour for 3 hours or something like that. Make sure that you apply this and any other bits of advice that you were given. So that's the end of our back exercises to desensitise lower back pain. Make sure that you let us know how you get on and contact us within 3 days if you don't experience any pain relief.